All right, today we're diving into some of the trickiest views in all of radiography. We're talking about the sacrum, the coccyx, and the sacroiliac or SI joints. These are deep, hidden structures, and getting a good picture of them, well, that's a real test of skill. So let's get into it.
That's really the big question here, isn't it? These aren't bones you can easily feel or palpate. They're buried deep inside the pelvis. And that's our whole challenge. How do we make the invisible visible? Don't worry, though. We're about to break down the exact techniques that let you do just that.
So here's our game plan. First, we're going to look at the pelvic blueprint to really get a handle on the challenge. Then, we'll hit each area one by one, the SI joints, the sacrum, and the coccyx. And to wrap it all up, we'll put it all together with that all-important lateral view.
Okay, first things first, the pelvic blueprint. Look, before we can even think about taking the perfect X-ray, we have to understand exactly what we're up against.
Here's the core of the problem. These structures aren't just floating in space, right? They are totally surrounded and overlapped by the dense, complicated bones of the pelvis. This means we can't just point the X-ray tube straight at them. We have to get clever and use very specific angles to basically peer around corners and through other bony structures.
So, let's zero in on our first target, the sacroiliac joints. When it comes to the SI joints, the name of the game is opening them up. We have to get the joint space perfectly aligned for the X-ray beam to pass through cleanly. And to do that, we're going to use a really important technique called an AP axial projection. So instead of a straight 90-degree beam, we're going to angle our central ray. Think about it like trying to peek into a mail slot. You can't look straight on, you have to tilt your head just right to see inside. That's exactly what we're doing here with the X-ray tube. Okay, so our foundational view for the SI joints is the AP axial. The patient is just lying flat on their back, totally straight, no rotation. Then we angle the tube 30 to 35 degrees up towards their head. That's what cephalad means. We center about 2 inches below the ASIS, those bony points on the front of your hips. And as we'll keep saying, you always have them hold their breath. Now that 30 to 35 degree range, it's not just a suggestion. This is where the real detail comes in. For male patients, you're going to use a 30-degree angle. But for female patients, you need to go a bit steeper, to 35 degrees. This is all about accommodating the natural differences in pelvic anatomy to open those joints up perfectly.
Now, what if we need to see just one SI joint at a time? For that, we use obliques. And this right here, this is the one single rule you have to burn into your brain. To open up an SI joint, you have to get that joint perfectly perpendicular to your image receptor. That's it. That's the secret sauce.
So how do we make that happen? Well, we've got a couple of ways to do it. If the patient's on their back, that's an AP oblique, we're actually looking at the joint that's UP, the one farthest from the image receptor. So to see the right SI joint, you'd roll the patient into a left posterior oblique, or LPO. But if they're on their stomach, a PO oblique, it's the exact opposite. We see the joint that's down, or closer to the IR. So for that same right SI joint, you'd use a right anterior oblique, or RAO.
All right, let's shift gears and talk about the sacrum. Now, the challenge here is totally different. The sacrum has this big natural curve to it. If we just shoot straight on, it's going to look all bunched up and foreshortened. So our goal is to use an angle to visually straighten that curve right out.
And the magic number that's going to let us do that? The key to unlocking a beautiful, clear view of the sacrum is 15 degrees. That's it, a 15-degree cephalad or upward angle. This angle sends the X-ray beam right down the length of that curved sacrum, essentially counteracting the curve. And what you get is this beautiful elongated image where all the joint spaces, especially where it meets L5, are nice and open.
So, you've taken the shot. How do you know if you nailed it? Here's your quality checklist. First, can you see the whole sacrum? Is it free of that foreshortening we were just talking about? Are the pubic bones out of the way? And finally, are the wings, the ala, perfectly symmetric? If they are, you know you had zero rotation.
Now for the last piece of this AP puzzle, the tiny little coccyx. The patient is set up in almost the exact same way as the sacrum view. But our technique? It's about to do a complete 180. We're literally changing direction.
So, what's the angle for this new direction? For the coccyx, our key number is 10 degrees. And here's that change in direction. Instead of angling up, cephalad, we're now angling 10 degrees down, or caudad. So why the switch? Well, the coccyx sits right behind the pubic symphysis.
By angling down, we project the coccyx just below the pubis, giving us a perfectly clear, unobstructed view. Our checklist for a good coccyx shot is pretty similar, but with one major thing to look for. We need to see the whole coccyx, of course. We absolutely have to make sure it's not overlapped by those pubic bones. And we check for rotation by making sure its tip lines up perfectly with the pubic symphysis.
Okay, time to put it all together. The lateral view is our grand finale. It's our chance to see both the sacrum and the coccyx from the side, which gives us a completely different perspective on how they're aligned.
Now, the positioning for this one is absolutely critical. Patients on their side with their knees bent up for stability. And this is huge. You have to make sure their knees are perfectly stacked one on top of the other. That's your best defense against pelvic rotation. We'll also use sponges to prop up their lower back so the whole spine is perfectly horizontal, parallel to our image receptor.
And that brings me to the absolute #1 most important thing about this view. If you take away nothing else, remember this. The goal is to have zero rotation. Any little twist in the pelvis, even a tiny one, will throw off the whole image and make it useless for diagnosis.
So how do we know for sure? How do we check for rotation? This is our no rotation checklist. On a true lateral, you should see the back edges of the ischial bones and the iliac bones as one single line, or very, very close to it. If you see two separate, distinct lines, you've got rotation. It's that simple.
And one final thought. This one applies to every single view we just talked about. The patient has to hold their breath for the exposure. Even the tiny little movement from breathing can blur out the fine details we're trying to capture. In this job, you have to remember, motion is always, always the enemy of clarity.
You know, we've talked about precision down to the inch, angles down to the degree. It's all based on physics and anatomy for sure. But coaxing a nervous patient into that perfect position, adapting for every unique body shape, it really makes you wonder, doesn't it? Is what we do more of a science or is it an art? Something to think about. Thanks for tuning in.